Hello, everyone. It's great to be here. I see a lot of familiar faces in the audience. Okay, and it just warms my heart to have this event take place. As Chris said, this is a activity that has been floating around in my mind and those of a lot of my colleagues for quite some time. And the vision was to bring together audiences, stakeholders from around the country to really talk about innovations in patient engagement, because we really see this as the critical ingredient to transforming our healthcare system. And whether you are care providers, whether you are on the payer side and employer side, or technology developers, you're all innovators in your own right. And I want to help support you. I want to help bring you all together and help foster collaboration, foster the development of great things. Okay, so I just want to share some thoughts with you on what I've seen over the last few years. Okay, both when I was at the Department of Health and Human Services, and now that I'm in the private sector and working with startups and developers, and on the nonprofit side, what we can do to kind of work together. Okay, so let me start off with a short anecdote to kind of like get the mood going. Okay. One of the things you do when you leave government is you have a lot of more time, okay? And I started watching, TV a lot more. Anyone watch Mad Men, TV show? Okay. Okay, great. We have some fans in the audience. Okay. For those of you who don't know, really, the show follows the story of key character Don Draper, okay, an ad exec, okay, on Madison Avenue, hence the term Mad Men, and his family and his kind of trials and tribulations over the years. Okay. And though this story's not really core to the show, it really struck a chord with me, and I thought I'd bring it to attention. Okay, there's this scene in the second season where Don Draper and his family they're in a park. Okay, they're having a nice picnic. Okay, it's the 1950s, late 1950s, and they're about to end. They're about to go home. Okay, a nice Sunday afternoon, well spent, and Don, finishes drinking his beer, and he tosses it into the bushes, okay? And then Betty, his wife, gets up, picks up the blanket, shakes off all the wrappers and food and other things onto the ground, and pack up, and they start to leave. Okay, here's a snapshot of the scene, okay? And something struck me as something really wrong is happening here, okay? What is going on, okay? This is not normal behavior for a well-to-do family. At least not that I thought so. Okay, what is happening in this situation where trash is just casually being thrown around? Okay, and it's a public park. Okay, and things are going on. So I did a little bit of research. I talked to some grandparents, going on the internet, because I was really curious to what was going on. And it turns out littering was actually very common. Okay, in the 50s and 60s, okay, and probably still prevalent today, but to an egregious degree compared to what we have now. Okay, when I was a young child in the late 50s and early 60s, littering, particularly along highways, just throw trash out the window was simply not something one thought about. You just did it. It was commonplace. Okay. The concept of casual littering was very prevalent, and you didn't really consider why this was, okay? And I thought, that is even more appalling now that I learned about it. And I just had this expression that hung over me for the next few days, okay? And that was just shock. And I said to myself, how can this be? Okay, what actually went on during this time? I was very curious. Okay, so I did a little bit more reading. Okay, not only why this problem was the way it was, but how it actually changed and permeated through American thinking. Okay, over the years, and I think it's really relevant to the conversations that we'll be having over the next 2 days. Okay, so littering post-World War II. Didn't think that you would see the subject being presented today, but I want to show it as a case study, okay? After World War II in the 1950s, strong economic growth was taking place. Strong American manufacturing, new brands, new products were being put out. Okay, there were innovations in manufacturing and particularly packaging, okay? As we saw innovation of new wrappers, new ways to take food and other such items on the road with you, and that combined with the development of the American freeways, highways, and vehicles, okay, using commodities that were now available in abundance, okay, contributed to a culture where leaving trash was a matter of convenience. And it was viewed as someone else's problem, okay? We had people that would come and pick up that stuff, okay? And if I wanted to, I would just casually throw it on the ground and be done with it. It would be out of my mind, okay? It was not something people consciously thought about, okay? So with me so far? And if you might be thinking, well, this is something that we could, create laws around. We can, make trash cans and other items available. Okay, and actually, there have been littering laws on the books of American cities and states for quite some time, but it's actually really hard to enforce those laws. I throw a piece of trash on the ground. Very few people are going to see it. Okay, and very few people will notice and care because it's part of the norm, the environmental context that one lived in at that time. Okay. How would one, enforce that law? How does one, create that sense that this is not acceptable behavior, that people should be more responsible in terms of what they do, okay? So looking at the timeline of what actually happened over the course of the next few decades, littering as a social cultural challenge, okay? We had in 1953 a group of businesses, manufacturers, who came together and they partnered with the group called the Ad Council to create a campaign called Keep America Beautiful. Okay, I don't know if anyone in this room remembers this campaign. Okay, great, there's some of you. Okay, but this was a first type of effort to bring together to address this problem from a private sector standpoint. Okay, one might debate on what the rationale is or what the goals were of this organization, but the campaign launched nonetheless. And then we actually had a coining of a new phrase in 1954, okay, or a popularization of a new phrase, litter bug. Didn't want to be a litter bug. Okay, you wanted to, keep your trash and put it in the place that's where it's supposed to go. Put litter in its place. Okay. In 1956 and 1960, we had public littering laws, I guess, displayed publicly. Okay. You probably wherever you live see lots of signs that say, X dollar fine for littering. These laws are actually rarely enforced, but they keep the topic of littering in the background of one's mind continually. Okay. We had public service campaigns that were springing up on a state-by-state basis. Okay. And so this was entering the American consciousness of what was appropriate, what was not. Okay. Setting changes in the way we think and the way we behave in public with regard to trash. Okay. In 1965, the vice president's wife, Lady Bird Johnson, announced publicly that she would make it her mission to keep America beautiful, and she partnered with various entities. She actually, did advertisements with famous celebrities, including Lassie the dog, okay, and said, this is what we do. We as a nation need to come together, okay, and she put herself out as an icon for Keep America Beautiful. Okay, so for those of you who are following along from a historical standpoint, please bear with me as I try to retell this story. Okay, and that was only the beginning. Okay, through 1965. Okay, it actually hit its stride in terms of social cultural change in the 1970s. Okay, we had iconic advertisements where we a very famous advertisement campaign, if you will, with Iron Eyes Cody, okay, talking about pollution and how only people could change pollution. We had, advertisements with cartoon figures, Woody the Owl, okay, and don't give a hoot, don't pollute. I don't know if any of you remember those campaigns, right? But they were very prevalent, okay, and importantly, they didn't say exactly what one should do, okay. They sought to make an emotional connection, okay. I guess those who were behind these campaigns spoke with artists. They spoke with communicators, those who could tie into the, emotional sense of what was right and what was wrong. Okay. There was research being put out on litter. I guess being a litter researcher was a job title back then. Okay, and there were publications and innovations around trash. Okay, new types of trash cans, new types of disposable materials. The concept of trash cans being publicly available on city streets was kind of a new thing. Having them available at gas stations was a kind of a new thing, okay? And those innovations came to bear. And those services became prevalent within the American consciousness. We had a program that actually spoke to young students, waste in place. Okay, actually, talked to a few teachers who actually taught this curriculum, which was provided, a public level. There actually was actually like little handouts and little exercises that we taught kids at that time to not litter, not be litter bugs. Okay. And then we had a rather curious innovation, adopt the highway. One could actually participate in the littering efforts as a third party, okay, and have their advertisement be part of a cleanup effort, and you would see road signs. And essentially, an organization, company could actually adopt the highway and help contribute to the process. And then a very ingenious effort that took place in the mid-'80s, don't mess with Texas. Now, I thought this was just a cool bumper sticker that one had, Texans, had to signify pride in their state. But it was actually had its genesis in anti-littering, anti-pollution efforts. And that program continues to this day. Anyone here from Texas? Okay, a few of you, are you aware of this program? Okay, so it basically shamed people, okay, into not being part of the problem, but part of the solution. Okay, so what is actually happening here? 60 to 90% reduction across various state programs in littering, okay, and littering efforts, particularly in public parks, city streets, and importantly, American highways. Okay, an incredible change in thinking over a short period of time, okay, relatively compared to other policy initiatives. Okay. So how did we get there? Okay. It wasn't just a matter of creating laws and providing opportunities. There was actually very specific strategy in terms of how we got there. Personalized communication that really spoke at an emotional level. Okay. Think of the Native American talking about his homeland. Okay, he actually turned out to have Italian ancestry, but what people saw during that location was, someone who emotionally felt the impact of littering. We had Woody the Owl, very likable character that spoke to school children, and we had Don't Mess with Texas, a great, I guess, campaign to really speak to why you shouldn't participate. That's not by telling you that don't put that trash on the ground, but you want to be one of us. Okay, you want to have pride in your state and don't mess with Texas. Okay, it focused on the belief, the mindset, and the outcomes of all stakeholders. Not just saying, these are laws, these are what the one-size-fits-all approach, but they were actually targeted approaches, okay? We had incentives, okay? So certainly positive incentives. In the early 80s, we had aluminum can redemption programs that sprung up in about 12 states across the country. I was born in New York, and I remember very well, okay, you would get a nickel for each aluminum can that you turned in, okay, for sodas and bottles and other I guess, things that often wound up as trash. In California, Michigan, other states, those programs were very successful. Okay, so there were incentives, positive incentives. Okay, and there was, the negative incentives were there as well. Okay, we always had the laws. We made them very visible. Okay, one did not want to participate and be part of that group. Don't want to be that, guy or girl to, participate in that process. There was clear, visible leadership. Okay, to take on the challenge, and we saw that through print, radio, and television media. And then there were clear opportunities for participation, such as the Adopt the Highway program, okay, or the pitch-in program. You see that often on trash cans in public places. Research and technology served as an underlying infrastructure to help move some of these concepts along. Okay, so think about that. Over 30 to 40 years, what we had was a change in mindset of something that was very commonplace, okay, casual littering, to something that wasn't found very often. And you still see litter, don't get me wrong, in places of the country, but it's substantially subdued compared to what it used to be. Okay. So the question I have to you is someone time traveled from the future to present day, what aspects of patient interactions would shock them? Okay. All right? So we have a time traveler from 2030, 2040, okay, who goes back in time to present day, okay, and starts interacting with one of you. You tell them about how things are done today. What parts of that would be appalling? Okay, and I'm going to walk through what I've heard as some common responses, okay, and you tell me if you agree with them, okay. So, first of all, there's what we don't have. We don't have lack of data, lack of technology and physical resources to support the issues, lack of a comprehensive infrastructure facilitating care coordination, lack of timely and continued patient access to information. Okay. Many of these issues are very near and dear to my heart because I was, supporting health reform and technology adoption through the Office of the National Quarter and meaningful use and the implementation of robust health information exchange was something that we worked passionately for the last few years and have been trying to implement across the country. I'm very happy to say that EHR adoption both on acute and ambulatory level have increased significantly over that time, but there's still much more work to be done. So lack of technology, lack of data, physical resources. And then we move on to the quality of interactions. Okay. Why isn't the majority of interactions between healthcare stakeholders efficient, personalized, and fostering bidirectional communication? There's a lack of informed decision-making, continuous and seamless interactions to promote health. I understand when you're sick and you're not feeling well, you go to a care facility or you see a provider, a clinician, a nurse, a physician. But what happens in 99% of time throughout one's life otherwise? Do those interactions take place? Okay, are we engaged in maintaining health, in the application of preventative services to help prevent catastrophic events? For the large part of American society, the answer is no. Okay. Lack of preventative interactions with care providers. It's not taking place, and we have the technology to help facilitate those. Okay. And finally, I'm going to move on to a category that many of you might not be thinking about, okay, which is the lack of belief and mindset around patient engagement. Okay, and some of you forward-thinking organizations are actually tackling issues like this. How are you addressing the lack of a patient's desire to be engaged? Okay, care providers and other stakeholders often sit in a position of authority and have more information than anyone else. And how do you communicate with those who just don't know what the process? I'm not talking about education. Okay, I'm not talking about giving handouts or providing them resources to read up on. I'm talking about real communication to change the desires and beliefs of those who need the help the most. Lack of understanding of the value of engagement. Is that taking place? A lack of desire for shared strategies to promote health and wellness. And finally, one issue that I think is very important that very few are actually tackling today, a lack of symbols, stories, and rituals around patient engagement. This really speaks to those who communicate, those who paint, those who are poets and artists, and help tell the story of why these things are necessary to one's happiness, one's health. Oftentimes we see engagement as transactions, as the attainment of metrics, very discrete, bounded events, when actually it's part of a pathway, part of a continuum. And I challenge you to think about engagement in that sense. So it's my thesis, okay, that changing attitudes, values, and the aspirations of patient engagement results in a cultural change. Okay, we need to emphasize the relationships in addition to the interactions and physical resources. Okay, and ultimately this manifests in behavior, both current and future. It's great to have a patient portal. Okay, it's great to have a large marketing campaign around engagement. But what does it lead to? Does it lead to improved clinical outcomes? Does it lead to a change in the ideas, the beliefs, and the culture of the populations that you're managing? Yeah, the question, your attempts at innovation, okay, and it's certainly fine to have discrete endpoints, but how does that lead to changes in long-term behavior? Okay. And This is something that I challenge everyone over the next 2 days to think about. Okay, this is a great example. It's a Fitbit, okay, and it's an item in high demand. It's a new Fitbit Flex, and this is not a personal endorsement. I just picked it as a great example of what I'm talking about. My wife has been searching, okay, for I guess this little, personal digital pedometer for quite some time, and she actually got one the other day, okay, and she put it on. And this is great, okay. We actually had the Fitbit, and now she's using it on a daily basis, okay. And I asked her, what is the point of the technology in her mind? Okay, is it to have on our wrists, okay, and track and see the data, or is it to change long-term beliefs and concepts around fitness and engagement around one's health? Okay, and ultimately, I believe that great technologies and innovations like these lead to behavior changing the cultural mindset of individuals. Okay, so think about that, okay? It's not enough just to have, not enough just to implement, okay? They actually have to lead to changes in behavior and thinking. Okay, so in summary, the sustained pathway to triple aim, better health, better care, lower costs, requires patient engagement, cultural change. Okay. And over the course of my time, where folks would come in and ask me to take a look at what they were developing, I would ask them, how is this going to change behavior, and what is the likelihood that this would impact the culture of the target populations they were looking at? And I saw some real winning ideas, okay, and some that needed a little bit of polishing because the technology infrastructure they were trying to put in was incongruent with the cultural landscape that exists today. And it's important to think about when developing because it's not always feasible because it's not the right time. The society at large isn't ready for that. There was one organization that came in and they were really excited. I really loved their enthusiasm. And their concept was, average lifespan of a male is 73 years, average lifespan for female is 79 years. It averages out to about 28,000, 30,000 days in one's life. So they wanted to create and receive public funding to build a life clock, okay, a countdown of those 28,000 days, where every day you would see basically your minutes and hours ticking away, okay, and they would give little reminders on how you could, extend your life clock, okay, so that one could, benefit from having that useful information in front of you. And I told them that, I think this is a great idea to educate and to provide resources. But really, seeing a clock in front of me just makes me sad. and I applauded them for their initiative, but you have to conform to the cultural mindset of your audience and what their willingness to adopt and conform and change their beliefs would be. Would suddenly, the maddening throngs be, having clocks in front of them to show them what, how much time they had left in their lives? Maybe. Personally, I thought it was unlikely. Okay, but this is a great illustration of how we need to adapt to the culture around us. Another great example was an organization that wanted to collect friends and families from one's Facebook feed, okay? And whenever you went to a physician or a care provider, the data that you received from that care provider would instantly be sent out to all your friends and family so that they could help support you in your health and well-being. And I said, that's a great idea in concept to, bring together communities to help support one's health. But most people are very private about that, okay? And we're not ready as a society, in my mind, okay, to share instantaneously all of that information. And then there was the privacy issues and security issues are involved in that as well. So that's another great example of, idea really good in concept, okay, that was grounded in research, but, had to adapt to the culture around us, okay. So, perspective on innovation in patient engagement. As Chris said, I think it's never been a better time to be an innovator in healthcare. We have alignment of policy and market forces to support those who are developing and creating and trying to contribute to these efforts. And in part because the consequences of not doing so, of not creating better patient engagement tools and applications and helping to contribute to that cultural change is something that we don't want to consider. Okay. The policies that have been implemented over the last few years have essentially created an innovation imperative, one where we must develop, we must come together and create new things to initiate change, innovation to cultural change, and innovation as part of an emerging ecosystem. And that's a point I really want to highlight, is that as you all are developing, you're not doing so alone. You're doing so as part of a large continuum of other innovators and other stakeholders who are currently providing care or investing in the provision of care. And it's important to acknowledge that. We aren't just a fish in the pond and fish in the ocean. Okay? When we come together, when we innovate together, acknowledge one another, and take advantage of one's resources built on top of the infrastructure that has been taken place, we're part of a coral reef. Okay? Think of the diversity that exists within this environment and the advantages one can I guess, elicit by working together and trying to draw from one another's strengths. Okay? We're not an individual painter, okay, trying to create something beautiful. We're part of a renaissance, okay, where there's amazing things being done, okay, some of which are just going to get us part of the way, but society as a whole, I believe, will change culturally. And we are actually going through that evolution today. Okay? It may take a great deal of time, but I have no doubt in my mind that the intensity, the mojo, the spirit of the American innovator is there. Okay? And finally, in deference to a friend of mine who's very passionate about a certain period of music making, we're not just performers. Okay? We're part of Beatlemania. Okay? We're part of a movement that is going to break through the silos that we currently hold today and spill over into the mainstream public. Okay? When you see this on TV, when you see Oprah and all these other parts of popular culture starting to pick up, okay, cultural changes in our interactions with health and wellness, okay, not only with the institutions that currently exist, but also within ourselves, then you know that we're very rapidly reaching a tipping point. So my fervent hope, my real dream is that each one of you culturally change patient engagement to shock future generations. Okay? It's my belief that when we reach the future years from now and looking back, we will be appalled at the kind of state of affairs that we have today. Okay? We'll be appalled at the tools that we armed our clinicians with, physicians, nurses, and other folks who are passionate in providing care. They're given so little in terms of information compared to what can be. Okay? And my goal isn't to say we should overwhelm them with all this technology and data, but do so in a manner that makes them more efficient, that allows them to practice the care, okay, and the love that they were trained to do so. That our concepts around care isn't one where we reach out when something really is happening bad, when the light is flashing red and we're not dialing 911. But we're maintaining health and wellness on a continual basis. Okay, and I think that is something really worthy to look out for. And a final thought for you all: the systems that we are putting in today is going to be responsible for the care and the well-being of the children of the 22nd century. Okay? And I think it's on our shoulders to kind of build that infrastructure and put forth that level of thinking, okay, that will culturally change the environment that they live in. So thank you very much. Okay, thank you for all that you do. Okay, and as Todd Park likes to say, may the force be with you.
Grab a chair. We're going